Hello everyone and welcome to another episode. In this one I'll be discussing about COPD, chronic obstructive pulmonary disease. This will be a complete tutorial to the extent possible within a fairly long video. A tutorial in easy to understand language for patients who may be suffering with COPD or for those of you who may be interested in understanding this condition better. So this comes because on the 16th of November 2022 is World COPD Day. So I will be trying to raise awareness with this little video or episode just to contribute to a better understanding of this condition. So basically, I have a couple of talking points for you today. I'll be discussing about what is COPD, how to treat COPD, so talking about inhalers, about tablets, about treatment for stable COPD versus exacerbations or flare-ups of the condition. I'll be talking about other treatments which don't involve pharmacological means, so stopping smoking and avoiding other exposures that may worsen COPD actually and make the condition more problematic. Pulmonary rehabilitation or exercise programs for the lungs, targeted for the lungs, and words on oxygen therapy, which is a very important component of treatment actually in COPD, especially in its advanced forms. At the end, I'll just conclude with a discussion about conditions associated with COPD, which many people may have and which may require treatment as well in order to obtain the maximum benefits and ensure that the body does not destabilize more because of these competing conditions, basically. So this is a bit of an overview of what I will be covering. Now, it's very important to say that I am not your personal physician. I'm not your doctor. I don't know exactly what your situation is. So anything that I say in this video may not fully apply in your case. However, I will do my best to give you an overview of the condition to help you get a better understanding and have a good basis for a conversation with your doctor when you end up seeing them. If you are troubled by any chest symptoms, if you have worrying medical problems, go see your doctor. In the area of the world where you are, try to find a physician who can actually provide you with a consultation, with treatment, concrete steps to actually move forward to improve your health. So that being said, I'd like to just go back to this list and I will start with the first thing. What is COPD? So COPD stands for, it's an acronym, it stands for chronic obstructive pulmonary disease. So this may sound like a mouthful, but basically it's very easy. And if we understand the term, we understand more or less what the condition is all about. So chronic just means a condition that doesn't really go away, a condition that lasts for a long time, then all your life, basically. So chronic disease. Obstructive means that there's a blockage. Pulmonary refers to the lung. Disease obviously refers to a disease of the lungs. Now, if we were to compress these terms, it would basically mean that we are looking at a condition in which there is a blockage in the airways, in the circulation of air. Chronic obstructive pulmonary disease. It's a condition that affects mostly the airways, but it's really a mix between two entities, chronic bronchitis and emphysema. And I'll explain all of these things in detail. But what basically happens, the gist of it, is that in COPD, people can inhale a full breath of air, but they can't really take the air out of their lungs quickly enough. So between two consecutive breaths, there may be a little bit of air that remains there and tends to build up between subsequent breaths. So as we sort of breathe faster because we're doing something a little bit more strenuous, we end up in the situation where there's no more room to take in more breath and we have to stop. So that leads to a sensation of tiredness, fatigue, breathlessness on exertion. So this is one of the main symptoms of COPD. Now, because in COPD, we do talk a little bit about chronic bronchitis, which is defined by chronic cough, productive cough, so not dry cough, so generally productive of mucus, phlegm, that occurs for a few months of the year at least. This is also part of COPD. So chronic cough is also a pretty important symptom in some COPD patients. And cough and shortness of breath on exertions are the hallmark symptoms of this condition. There may be other things as well that may be going on, but these are the main ones. So generally, I would recommend if you have such symptoms, if you are very breathless when you're doing anything strenuous, this has gotten worse in recent years, you have a chronic cough that doesn't go away, I would recommend that you go see a physician, because COPD is always a possibility. Now, I forgot to mention something really important here. COPD is generally a condition that doesn't occur in the younger ages. So it's usually a condition that's occurring generally after the age of 40, most commonly around 50 years old, in patients who have smoked for quite a long time. So it is unfortunately a condition that can be very preventable by just not smoking, but unfortunately that's not always easy. And many people have smoked for many, many years, and it can lead to the development of COPD. It can be related also to predispositions. So some people may be more vulnerable to getting COPD when they do smoke, or when they are exposed to environmental dusts, fumes, or other things in the workplace or at home. So there are quite a lot of risk factors for COPD, and unfortunately it does occur a lot. Well, let's move on a little bit with that. So we talked about chronic bronchitis and emphysema. Let me just clarify what these things mean, because these two entities, so both chronic bronchitis and emphysema, can both be present in COPD in varying levels. Some patients may have a predominance for chronic bronchitis, some may have a predominance for emphysema. Let me explain what these mean. Let's start with chronic bronchitis. Chronic bronchitis is a condition in which there is more and more mucus secretion in the airways, usually in response to something from the environment, something that we inhale that the airway doesn't like. So the tissue inside the airway tubes is irritated by something usually from the environment, mostly smoking. So smoking contains a large number of particles, oxidant substances, a lot of things that we inhale, a lot of compounds are inhaled. And the body's airways, they try to get rid of all the things that we inhale. That leads to more mucus production, and that eventually leads to this sort of phlegm that we need to cough up quite a lot. So that irritation leads to the cough. If the cough with sputum production occurs for, typically in the book it would be mentioned, more than 3 months for 2 consecutive years, we would just really refer to chronic bronchitis in this case. Emphysema is another component of COPD. It's less to do with the airways, but with the distal air spaces in the lungs. So for example, those little branching airways, eventually they end up in a sort of a cul-de-sac situation where we reach the alveoli. So the alveoli are the deepest parts of the lungs, the deepest recesses of the lung, where the actual gas exchange occurs between the body and the environmental air. So that's where we absorb oxygen through these alveolar walls, and we release the produced carbon dioxide. So that's really important. In emphysema, what happens is that that surface area of the alveoli becomes smaller and smaller. Usually this is to do with oxidation related to smoking. Unfortunately, in many cases, it can be related to genetic predispositions, but that's actually much more rare than actual smoking for many, many years. Another thing to mention about COPD is that these symptoms of breathlessness on exertion, on strenuous activity, this cough, they are relatively constant. So they don't occur in attacks. Even though you may have good days and bad days, generally the symptoms are more or less the same. So they affect your life slowly, sometimes without even noticing. Many people actually put the symptoms of COPD down to getting older. But if you see someone who is in their 50s and they cannot climb a few flights of stairs because they're really, really breathless, that's not something to do with aging. That's generally something to do with a condition going on in the body. It may not all be COPD. There may be other situations going on, other conditions, but it's really important to check. But COPD is a very, very common condition, very, very common. So this is just to set the stage a little bit about what COPD is. Let's talk a little bit about treatment. So how do we treat COPD? Because it's a condition that mostly affects the airways and the lungs, the best way to treat COPD is with inhalers. So we use medications in inhaled form. So it could be a number of these inhalers. Actually, the ones that I showed on the video just now are probably not the right ones for treating COPD, but they're the ones that I have here. It's just to show you that we generally use devices through which we inhale some medication directly into the airways, directly into the lungs, because that will mean that we need to use only low doses of medication to reach directly inside the airway and have an effect. Now, the effect that we seek in COPD is to control breathlessness in the first instance, because breathlessness on exertion can actually be very debilitating. People who were used to working quite a lot, to doing exercise, going on walks with their family, they suddenly can't keep up anymore. So if we can provide some medication to the airway that will relax the muscles around the little airways and actually give us more space to breathe, then that's absolutely perfect, because then we'll be able to breathe better, to do more. So sometimes we prescribe these inhalers to do just that, to act on the little muscles inside the airway to relax them. And there are many types of these bronchodilator medications. This is what we call these medications that dilate the airways. They relax the muscles around the airway to make them a little bit bigger. Bronchodilators can be short-acting, they can be long-acting, they can be beta agonists, they can be antimuscarinic agents. So all of these are different types of bronchodilators, and they are generally combined in various forms in order to create a treatment plan for COPD. Now, the most commonly used inhaler obviously is the salbutamol or blue inhaler or Ventolin inhaler. Unfortunately, in COPD, this doesn't really provide enough effect because it just lasts for about 4 hours. And once the effect is gone, people need another boost, another administration. So what we tend to prescribe in COPD, according to the more recent guidelines, is long-acting bronchodilators. So medications that once inhaled will give an effect for 12 to 24 hours. So if we can go for the 24-hour effective inhalers, that's the best way, because imagine you just take the inhaler once a day and it keeps most of the symptoms at bay. You are able to move on with your activities, your daily life, etc. So in treatment guidelines, the usual treatment that we start with is something called an antimuscarinic agent, which could be something like tiotropium. Tiotropium is a medication that's contained in a well-known inhaler called Spiriva, or Braltus is a generic of the same medication. There are others as well. So the treatment mustn't necessarily start with this one. It's just one possibility that's quite common in stable COPD. The first time it's diagnosed, if it's not very severe, people may be started on just a single bronchodilator taken once a day. It usually acts throughout the day, so that should improve symptoms quite a lot. It's important, though, as you can see, to detect COPD early when the treatments are simpler. Now, if the COPD is a little bit more severe, we can go for combination inhalers, where we inhale potentially 2 types of different medication in the same inhaler, in the same administration. So we're taking a single puff and we're inhaling 2 medications or 3 medications. So these treatment plans can be tailored according to the patient. So if we are looking for symptomatic benefit to control the breathlessness as much as possible, we may prescribe 2 types of long-acting bronchodilators, so these medications that ease the breathing, in the same inhaler. So that can be sometimes prescribed. Things like Spiolto, things like Anor or Ellipta, or another example would be Ultibro. These are all dual bronchodilators. So you inhale 2 bronchodilators in the same inhaler. This usually controls the symptoms much better, especially if you're having quite a lot of breathlessness. Obviously, there are different types of patients with COPD. Not everyone has the same symptom. Some COPD patients may experience a lot of exacerbations or flare-ups of their condition, which may be similar to chest infections, but not necessarily. Sometimes they're just worsening of symptoms of COPD that require a change of treatment. That's usually the definition for an exacerbation. Now, in order to prevent these exacerbations, we really work quite hard as physicians and patients, because Preventing exacerbations is key to preserving lung function over the long term. Usually when there's an exacerbation, there's a big drop in lung function that is really hard to recover because the lungs really are affected when these flare-ups occur. So preventing those can be a challenge. It can be achieved sometimes with these long-acting bronchodilators that I've discussed before, but sometimes we need to add something called inhaled corticosteroids to the inhaled treatment regimen. Inhaled corticosteroids are anti-inflammatory medications. If you hear about corticosteroids, people tend to have a bad association with these medications. They consider them prone to giving a lot of side effects, which may be true, but it's usually true at very high doses. It's very dose dependent. In the cases of inhalers, we are using fractions of those doses that are present in tablets that we may have to swallow. So they are very safe. So the dose of inhaled corticosteroids is very low, but because it's inhaled directly into the airways where it can control that inflammation that may be triggering those flare-ups, they can be quite effective. Inhaled corticosteroids, though, in COPD are generally prescribed in more severe cases or in cases where people do experience more than 2 of these flare-ups each year. That's a general ballpark figure, but your doctor may have a different plan in mind for you, depending on your individual case. So this is basically an overview of how inhalers are prescribed. People may also be prescribed short-acting bronchodilators, things that can be used as needed as a top-up for managing some symptoms that may occur throughout the day. So that can be in the form of a Ventolin inhaler, like I've discussed before, an Atrovent inhaler. There are a few of these examples. So these are the types of inhalers, the overall types of inhalers that are available. Now, let's move on to tablets. Are tablets really useful in COPD? Some may be used, but not a lot. So unfortunately, there are not a lot of tablet treatments for COPD. There are quite a lot of treatments in development for COPD. It's an area of significant research, as you may imagine, because it's such a common condition, such a difficult condition to manage. But traditionally, we would only use something called theophylline. Theophylline is a substance that is similar to what we would find in tea, and it does have an effect to dilate the airways. However, if we give this as tablets, we tend to need to give a fairly large dose, which may have other effects as well. Imagine you're swallowing a tablet, it has to dissolve within the body, eventually reach the airways. It also reaches other organs where it may cause an effect. So sometimes people may overdose slightly on the theophylline, especially if they take too much of it, which may lead to, a bit of shaking in the easiest form to more severe issues like heart disturbances or some other complications. But theophylline can be actually used as a top-up to inhaler treatment. In some COPD patients, especially the ones who have more severe disease, adding theophylline can actually be beneficial, and they have noticed some effect. There are some other tablets that I will not discuss in this video, but do ask your doctor if there is anything that can be used in this regard in your case. However, the main type of treatment for COPD is usually inhalers that need to be taken correctly. So if you have a good inhaler technique, it's probably going to lead to a lot better effect. It will control the condition much better. So taking inhalers with the correct technique, always remember, if you're going to see your doctor, take your inhaler with you, show your doctor how you are using it to get some feedback and some suggestions on how to improve. Do that at every consultation. It will be extremely helpful, in my opinion. Then let's move on to some other things. So there is another situation in which we may have to use tablets that we swallow to treat COPD, and that's in the case of exacerbations. So we talked a little bit about flare-ups and exacerbations of COPD. These are situations in which the symptoms of COPD, so cough, sputum production, breathlessness on exertion, they tend to worsen quite significantly. These exacerbations can occur quite suddenly, and they may be caused by a chest infection that happens. It could be an episode of pneumonia. It could be a viral infection. It could be exposure to a large quantity of smoke, to some irritant substance that you've inhaled in the lungs. It can be caused by a lot of things. But once these exacerbations occur, they need to be treated quite promptly. In these situations, if there is an infection, for example, a person with COPD may be given antibiotics, a short course of antibiotics. They may be given a short course of corticosteroids as tablets, so a higher dose, a burst of corticosteroids as tablets for 5 days, for example, to try to get control of the inflammation in the body that's leading to these excessive COPD symptoms. Sometimes patients may actually need to be hospitalized in these situations. They may require nebulizer treatments, which are higher doses of these inhaled bronchodilators, for example, such as salbutamol, but given regularly and in higher doses. In some instances, especially in severe cases of COPD, there may be a need for non-invasive ventilation, which is basically to have a machine help us breathe. Oxygen may be required in these situations. So exacerbations of COPD are very scary events, and we must do everything in our power to prevent them. Now, one way to prevent them is obviously to try to avoid exposing our lungs to anything that can be noxious, but also to consider vaccination for pneumonia, for example, for the flu. Things like that may actually help prevent viral infections or pneumonias that may actually lead to these exacerbations, hospital stays, even ICU admissions. So it's important to try to prevent them because, like I said, when we have an exacerbation for COPD, the lung function drops quite significantly, then it can be really hard to recover from that. Moving on to other things, but just before I do that, let me just mention. So I've mentioned the treatment for exacerbation, but before, the treatment with inhalers and tablets like theophylline is reserved for stable COPD. In flare-ups or exacerbations, the treatment for stable COPD generally continues, but we have to add on these other things that I've mentioned, such as the antibiotics potentially, the corticosteroids as tablets, all kinds of hospital procedures, nebulizers, etc. Let me move on to other treatments. So this is where we no longer talk about tablets at all or inhalers. The main thing, which is a treatment, in my opinion, for COPD, is to stop smoking. So if you've been smoking for 20 years and you have been diagnosed with a chest condition, really, please, I ask you to do your best. I know it's difficult, but try to do your best to stop smoking. It's not going to be easy for you if you continue smoking. And I know you may disagree with me. You may think that you've smoked for so many years, everything was fine. But if you've developed a respiratory condition, smoking, it's not going to help. Inhaling smoke that irritates your airways, it cannot help. It cannot stop all these processes that are in place where your body tries to get rid of the smoke particles, etc. All these things will drive COPD progression. It will make things much, much worse. So I know it is difficult. I really understand that. And I know that many people who have been smoking for a long time actually want to quit. It's one of those things, but it can be very difficult because it's an addiction. It's like a disease on top of COPD that you have to deal with. But there are treatments available for helping you to quit smoking. These can range from things like nicotine replacement therapies with gum, lozenges, patches. It can be things like bupropion or some other tablets that can be given to reduce the craving for nicotine, for the cigarettes. And it's really, really important because stopping smoking will probably be the single best thing you can do for your health, for improving your health. It's not only smoking though. Many people keep working in unsafe areas, let's say. So a lot of people will work in construction. They will be exposed to lots of dusts, things like that throughout the day. It's really important to try to protect your airways when you're at work. So even if your employer, for example, may not provide the right tools to protect you, try to consider buying yourself a good FFP2 mask that you can wear that is really snug around your airways and doesn't let you breathe in the dust, the smoke, the things that may be going on at work. Try to work in a well-ventilated space. If you can work outside, that's even better, to be in fresh air. But try to do these things because a lot of cases of COPD are driven by occupational exposures, smoking in addition to that as well. There's a lot of COPD also related to indoor smoke. So a lot of people may have stoves, may have wood-burning fires, things like that in the house. It's important to have a very well-cleaned chimney, good ventilation in the house to make sure that that smoke is not inhaled in the airways throughout the day. It's a major source of pollution. It can actually, this indoor pollution is a huge, huge problem. And really try to control that as much as possible. Try to take care of your airways, because it's really hard to get back to the baseline. Conditions like COPD are unfortunately irreversible. So once they are established, it's very, very hard to gain the health back. So preventing them from getting worse is essential. So that's why I insist so much on stopping smoking and other exposures to things that may be damaging for the airways. I'm not saying it because I mean, I understand that smoking can be a pleasure for some people, but if it is also causing a lot of pain, it's not worth it. I also understand that sometimes people's livelihoods may be affected by their work, and you cannot really quit your job even if you know that it's doing you harm. But at least try to put in place mitigating actions. So protecting your airways with a good mask, with a good seal, a good particle mask, well ventilated spaces. These things go a long way to stopping the progression of COPD. You don't want this condition to be getting worse. Think about it not in the immediate run. Think about it 5 years from now, 10 years from now. If you don't control what you're inhaling in your airways, it cannot get better. I'll stop with that part, and I'll go on to the next thing. Another major thing for COPD treatment is pulmonary rehabilitation. And this is something that unfortunately in many countries around the world is not really discussed. It's not really offered to patients. And please discuss this with your doctor. If you are suffering with COPD, discuss about the possibility of attending pulmonary rehabilitation classes or exercise programs. So these are generally formal programs in which yourself and maybe other patients who suffer with COPD will get together to learn how to do certain exercises for the chest specifically. These can be exercises ranging from those that help you clear secretions from the airways. So for example, if you're coughing and bringing up a lot of sputum, these exercises may help you cough more effectively, so you're not irritating your airways when you're trying to spit out some phlegm that doesn't really break from the chest. Or you may just be able to drain these secretions in a more effective way. Or if you're suffering with a lot of breathlessness, the most important thing that you need to do is try to not stop moving. It's really, really important to be active constantly, to still be walking within the limits of your own tolerance. So if you're getting breathless when you're walking, stop for a bit, but then keep going. And then if you go to a formal rehabilitation class, the physiotherapists there will probably guide you on what are the best exercises in your case to keep your breathing muscles active. It's really, really important. Otherwise, you are in a vicious path and a vicious circle in which the more breathless you become, the less exercise you end up doing, and then you become more breathless, and so on. It's this circle that keeps tightening its grip around you, and you end up in this situation where you're unable to do minimal things. I remember seeing some patients today, actually, that were suffering with advanced COPD, and they had to come to the hospital with mobility scooters. They couldn't really walk by themselves for long distances. After 20 meters or so, they had to stop. It's a really, really terrible situation. And some of that is not only the airways disease, it's also this deconditioning that happens with doing less and less exercise that leads to more and more breathlessness, etc. And if you think about exacerbations, what I've mentioned before, imagine if you are hospitalized for a flare-up or worsening of your COPD and you're in the hospital for a week or two. When you get out of hospital, it's really important to resume your activities as soon as possible and try to do as much movement as you can, because within those 1 or 2 weeks that when you were in a hospital bed, your muscles have atrophied a little bit. They've become weaker. And then when you come out, it will be even harder to recover. So it's important to always try to keep moving, to remember to always do it constantly. This is pulmonary rehabilitation, keeping your lungs in shape. So that will help you deal with things a lot better. Now, the other thing I wanted to discuss here is treatment with oxygen. So very, very important to discuss oxygen treatment. Why? Oxygen is generally thought to be, among the general public, a treatment for breathlessness or for end-stage disease. It's not always the case. So let me explain a little bit further. Oxygen itself doesn't necessarily treat breathlessness very well, because the flow required to correct the low oxygen levels in the blood is usually much less than the airflow you would require to feel less breathless. In those cases, if you're just trying to get some airflow to your face to feel less breathless, sometimes it helps to just sit in front of an open window or to have a little fan blowing some air to your face. There is something actually called fan therapy, where you use a handheld fan, which is battery operated, and then you use it to sort of just move it around your face, left, right, and then that usually tends to, basically that airflow that comes to your face, it tends to relax your breathing a little bit. So that is something that can work for breathlessness. Oxygen only gives you a few liters per minute of flow, generally. The oxygen concentrators, the various oxygen machines, they don't necessarily give you more than that. But that can be enough to correct low oxygen levels in the blood. So let me discuss about this a little bit more detail. When you have advanced COPD, the oxygen levels in the blood will no longer be normal because the lungs are not operating at their full capacity. They're not able to supply the necessary amount of oxygen to the body's tissues. That means that most of the organs of the body will start to operate in an anaerobic metabolism. That means that operating under low oxygen conditions, and the metabolism of all the organs of the body then changes. It shifts to something that was aerobic before, driven by oxygen, to something that's low oxygen, anaerobic. And when you have this situation, the energy conversion from the food that you eat, from everything that you eat, its conversion to energy to be used by muscles, by your heart, by the cardiovascular system, everything else, all the cells of the body, is no longer effective. So you're basically having to use a lot of energy to actually drive all your body's organs. It's like if you imagine a car, and I think this is a great analogy, if you block the air intake of the car will use a lot more fuel. And if there are some of you who are mechanics or like cars among you, you'll probably understand this principle. It's just because you need to burn more fuel to get the same effect. So imagine it's a complicated situation that can destabilize a lot of our organ systems of the body. There's also another thing here. So regarding the cardiovascular system specifically, if you are operating with low oxygen, your heart will work very, very hard to keep pumping the blood. So it will raise the pressures required, for example, to transport the blood through your lungs. There will be something called reflex vasoconstriction in the lungs. So the lungs try to adjust to this low level of oxygen, and the heart needs to push through much tighter spaces in the lung. It's something that can happen. So if we correct this with oxygen, the heart operates normally. So this can be done sometimes only on exertion. So many people with COPD, at least at the beginning, when they do develop low oxygen levels in their blood, they don't need to use oxygen all the time. It may be sufficient to just use oxygen when doing something really strenuous to take that load off the cardiovascular system and allow things to work optimally. So you may not require oxygen all the time, but using it when it's needed, according to a prescription, I'm coming to that in a second, is a form of treatment that has been shown to actually prolong survival. So it's really, really important. It's a form of treatment, and I understand psychologically it can be quite hard to use oxygen. You may feel like you're having end-stage disease, but actually using the oxygen will further delay the development of end-stage disease, which is really, really important. I talked about prescription for oxygen. It's important to not use oxygen unless your doctor recommended to use oxygen if you have COPD. What can happen sometimes is that in advanced COPD, the use of too much oxygen can be detrimental because some people may end up retaining more CO2. So that just means that your body feels that you're using too much. So if you're giving your body too much oxygen, sometimes it may feel that it doesn't need to breathe as often. This is really the simplification of what happens. And if you don't breathe often enough, you don't clear the CO2 from your blood. If that builds up, it leads to acidity of the blood, which also affects the metabolism of various organs of the body. So it leads to a lot of imbalances in the body. So that's why this balance between oxygen and carbon dioxide in the bloodstream is really, really important. So in COPD, you need to be really careful. So if oxygen is prescribed in an inappropriate way, too much in certain individuals, for example, it can be detrimental. Sometimes there can be too little prescribed. So it's important to have the right measurements. Usually these require measuring your oxygen levels potentially when you're walking around with an oximeter, sometimes performing an arterial blood gas sampling, which isn't necessarily the most comfortable procedure in the world. It can be sometimes be done from the capillaries of the earlobe sometimes. So checking the blood oxygen levels is very, very important to prescribing the right amount of oxygen. And you should stick to the amount that was prescribed in your case, because that's what's correcting the low levels. So try to avoid using oxygen only as a source of breathlessness relief, because there are better ways, like I said, with airflow from various sources to correct that, rather than to have oxygen only for that. The flow of oxygen that's coming through those nasal cannulae or masks is not as much as you would need to relieve breathlessness. So that's actually quite important. And delivery of oxygen is a very, very difficult topic. And I think it's really important to have a very honest conversation about that with your doctor. What device is the best for you? How can you use it around your lifestyle and all these things? Because oxygen, like I was saying before, is a form of treatment. So it's really important to understand that. Now, the final part of the video, I understand that it's been quite long already, but I'd like to just touch upon other conditions which may be associated with COPD. I think I've alluded to this a little bit before when we talked about how the pathology of COPD can disrupt the metabolisms of different organs of the body. So they may be working harder than they should. They may be working with not effective burning of fuel, let's say. So all that means is that there is a metabolic syndrome that occurs in COPD, which may lead to other complications. People may develop diabetes when they have COPD. They may develop vascular disease. They may have a lot of other issues that can be driven by COPD. A very, very big problem in COPD patients is maintaining a normal weight. Like I said before, if you're having to use so much energy to keep breathing, because your muscles are working much harder to breathe, and they're doing so under abnormal conditions, you may need to use a lot more energy that you cannot supply with normal food products. So you may have to eat hypercaloric diets. You may need to eat more food than you would want just to keep your weight stable. And losing weight is really, really important to prevent. It's important to prevent that in COPD. It's a very big complication. So if you feel that that's a big issue for you, if you've been losing weight, if your clothes no longer fit, it's really important to discuss that with your doctor. It can also be the sign of some other issue going on with the body that hasn't been diagnosed before. So treating these associated conditions that can be associated with COPD is really important. Sometimes if you treat these early, you won't need so much intervention. It's the same with COPD. If you treat it early, you may only need some inhalers that will correct your symptoms to a level that's acceptable to you. The same goes with high blood pressure. If you're developing high blood pressure, it's much easier to treat it at the beginning with maybe just one tablet or so and prevent end organ damage and worsening over time of the high blood pressure, because it starts a lot of positive feedback loops in the body. So a condition that starts off slowly tends to worsen over time. So it's really important to intervene early. I've been droning on about this throughout the video, but it's really important to see your doctor as soon as you can. If there's anything worrying you, try to see your doctor as soon as possible. The final thing I'd like to mention here with regards to other conditions associated with COPD is to do with depression and anxiety. So, of course, people who are breathless will feel anxious about their breathlessness, will feel anxious when they go outside of their house, if they feel they will need to take all their medication, maybe an oxygen device with them if they go outside. That can lead to a lot of anxiety. People who suffer with COPD, unfortunately, are very lonely sometimes because they can no longer maybe keep up with their friends, with their family. their sons and daughters maybe are busy with other activities, they cannot visit as often, they feel they are housebound, and this is a huge problem that many people who suffer with COPD stop leaving their house altogether. And as you can imagine, if you're just housebound, if you're feeling alone, if you're doing less and less exercise, your breathing becomes worse, your mental state will become worse, and it's sort of one of these other vicious circles that people get drawn into with COPD. So if you feel like you're getting the blues a little bit, if you feel like you're a little bit sad about the COPD, that's absolutely normal. And there are support groups online even that you can access sometimes for support. It's important, if you can, to go to these exercise programs, like I said before, to pulmonary rehabilitation, where you end up meeting other people who suffer with the same problem as you, who may really understand what you're going through. It's important to tell this to your doctor. If you're having no one visit you, maybe they can help you put something in place to help you around the house. Maybe there can be some adjustments that can be made to your house. For example, if your oxygen tubing, for example, is not long enough. These are simple things that can be addressed that may actually improve the way you're feeling, improve your mental state. And, it's just a very, very complicated picture. So fighting depression and anxiety and COPD is really important. And I say fighting it, it's really hard to fight it, I would say. This may be a bit controversial, but in my mind, if you can accept that that's something that can happen, and that if you are feeling down, you should be asking for help, I think that's really, really important. It's the first step towards feeling better and getting more positive health outcomes. Now, obviously, just coming back to the little list of things that I've covered in this video, just to do a quick summary and then to wrap it up. So what is COPD? It's a condition that affects the lungs. It leads to blockages in breathing. You feel like you can't get enough air because you can't get the air out soon enough. Comprising of chronic bronchitis and emphysema in various degrees. Some people have more of the other, more of one or the other. It's usually treated with inhalers. There are different treatment plans for early stage COPD, more advanced COPD, COPD with many flare-ups or exacerbations. Sometimes tablets can be added, such as theophylline, which may be helpful. There may be other tablets in your case or other treatments. There may be also clinical trials or new research projects that you may want to volunteer for. These may also be helpful. The treatments for stable COPD is, as I mentioned here, but then in exacerbations, we sometimes need to add other bursts of medications, such as tablets of corticosteroids, such as prednisolone. Antibiotics may be required for infection, all these things. There are a lot of other treatments besides treating with inhalers and tablets. Stopping smoking is absolutely essential. I know it's hard, but seek help to try to stop smoking, because it's probably the only thing that will stop the worsening of COPD over time. Try to avoid other exposures, to breathe as clean air as you can. That would be very, very useful to, again, stopping the progression of COPD. Pulmonary rehabilitation and exercise programs, if you can attend these, absolutely fantastic for health benefits, for social benefits. But also, if you can't access a pulmonary rehabilitation program because maybe one is not available in your city or in your country, at least keep walking. Keep walking, keep walking, keep walking as much as you can. If you need to use oxygen, for example, when you're walking, do it, but don't stop. Oxygen therapy is really important. It's a form of treatment for those who actually need it. It doesn't help as much with breathlessness. There are other things that can be used for breathlessness, including the exercise and including fan therapy, for example, when you have air blowing into your face. So that can be helpful. But oxygen therapy can be very helpful to prevent worsening of other potential conditions in the body. Takes this load off the heart, stabilizes the metabolisms of the body. And as I mentioned, there are other conditions that can be associated with COPD. There can be weight loss, there can be diabetes, high blood pressure, other things that may be going on, depression. All of these could be treated if caught early. And if you treat everything in little amounts, it's much better than waiting for things to get worse when the options are more limited. So that was to do with COPD. don't forget, 16th of November is World COPD Day. Tell someone about COPD. Tell them to get a checkup. It's really important to catch this condition early because the treatments can be much, much more effective at the beginning. Thank you very much for listening, and I wish you good health and all the best.